So I said, suck it up, Buttercup. You've got to live your best life, and you just had your first grandson born. You've got 3 granddaughters. I've got 5 kids that I love dearly. My husband, who I love dearly. I took my life back. We started a new YouTube channel, Destination Jackpot, shout out, where we were going to travel. Mike and I were going to travel. We were going to teach people about comps and a little bit of gambling and how to maximize and travel for less. And I got really busy with that, and it was a great distraction for me. And I was feeling better, it wasn't, I could live with it. I really could live with it. And so I did. We did that, went on about our life, all the normal things that we do, and working on a new business, working on our existing businesses. And all of a sudden, in, I guess, August of this year, 2024, I started having pain in this left arm and more pain in my neck and both sides of my neck. And I didn't think too much about it. I was taking Advil, and maybe it started even in July, and I started taking Advil and that would help take care of the pain. Still having the numbness in my fingers, but I decided we're just going to live with that. So I was. And then I started having these headaches, but weird headaches, like it would shoot from the back of my head up into my eye and behind my eye and into my ear. Like I thought I had an ear infection, but I didn't have an ear infection. It was caused from this pain in my head. Then it started having that same feeling in this arm that I had, weakness, picking things up. And I thought, well, I need to go see somebody. And I really didn't know who to go to at this point. My nurse practitioner at my PCP, she had pulled every string she could before. Even tried calling somebody that's a teacher, a neurologist, neurosurgeon that's a teacher, and asking him, where we could go, what we could do. And she dug and really tried to help me. So I made the decision to go back to, I kept taking the Advil and getting through it. And then all of a sudden one night, I didn't do anything different. I just moved my neck the wrong way and I froze, like my whole neck. I couldn't even get up out of bed by myself, and it scared me. And so I was like that for about a day. And I called my doctor's office, to that guy that did my back surgery, that neurosurgeon that did my original back surgery. But I told in the other video why I why I chose not to go back to him. But I trusted him because he had done my back surgery. And I thought, I need to give him an opportunity, because I didn't have success with this other neurosurgeon that did my surgery here. So let's go back to this doctor. So I called the doctor's office the day that I couldn't move my neck. And I said, told him what was going on. She amazingly got me an appointment for just like 5 days later, but I needed to get an MRI in between. So I went and got an MRI. Thankfully, by the next day, I could get myself up in and out of bed, but the pain was really severe in my neck still, but I could function, could get myself around. And I thought, I'm still going to keep this appointment. So I went to this appointment, brought my MRIs in, and I was shocked when he said that he felt like oftentimes when you do a fusion of one level in your neck, you oftentimes have to have more levels fused. No one had ever told me that. I hadn't researched my surgery because it happened so fast. I wish I would have researched everything more. I had no idea that was even a possibility or a thought. And that scared me. And he said, I'm suspecting that you have involvement at the C2 level, which is your spine is C1 all the way down to C7, and then you've got T1. Probably C2 and 3 because of these headaches you're having. I had no idea that your spinal cord is like a highway for your nerves. It's like your main highway, and then you have these feeder roads and other roads that come off of it, like your nerve. Your whole body is controlled by your spine. I had no idea. I didn't understand my body that much well enough. But when he showed me on this diagram that he had in his office, and I have the picture that we'll put up for you, that the C2 and the C3 affects your, this part of your head, which is where I was having my headaches, this side of your face, your ear, down this arm, to this finger, to that finger, to this finger. Wherever your pain is, you can trace it right back up to the spinal cord, to the area of your pain. So everything in mine, from C2 to 7, on this diagram, correlated with the pain that I was having. So I believed what he was saying. But he said, you've got on this MRI, that based on your MRI, your C3 to C7, C2 to 7 is involved, where it wasn't to this MRI compared before your surgery. So from the time that I had surgery, in just a little over a year and 14 months, my C3 to C7, so 3 to 6 rather, had bulging disc, narrowing, all these things that it didn't have, which told me, now I know, that it was this fusion, not being able to move that part of my neck, caused all of this to work harder, which is why I've seen significant decline in this upper part of my neck. That made sense to me the more I researched. So he said, I want you to have a myelogram. I said, what's a myelogram? He said, well, that is where you they'll insert this dye, and I can see more of the nerves and bone, whatever it is that he can see more of, by doing this myelogram. And I thought it was really interesting that no one had ever done a myelogram. Maybe that's common practice, maybe it's not, but common sense would tell me, and I hope it'll tell you if you're watching this video and you haven't had surgery, or even if you're thinking of another one, get a myelogram. That shows so much more to a doctor than just a CT and an MRI. So they can take the CT, the MRI, and the myelogram. To me, that gives them a better picture, and that's what he said, of what's going on. Now, I'll tell you, that was not a comfortable procedure at all. They lay you on your stomach, they insert this dye into your spine, by your spine, and then they invert you on this table and allow all that dye to go to your spinal cord, all over your spinal cord and your nerves. But I'm glad I had this done. But in the meantime, I'm talking to myself and I'm like, holy cow. I cannot see he said he would either go in the front, an incision that would go like this, or he would go in the back. So then I started researching anterior versus posterior, joined Facebook groups. It had not dawned on me to do that. And I don't know that I totally say for everybody to jump to a Facebook group. I've gained a lot of great advice through there, but we always have to remember when you're doing these Facebook groups or even listening to my videos, this is one person and it's their experience, and not every experience is the same. So I'm certainly not giving anybody medical advice. I'm just telling you my story and the things I wish I would have thought of before. And I think we got to look at those groups or those resources as their story and things they've done. And unfortunately, we are in a time of medicine where we have to advocate for ourselves, and we have to research, and we have to do things and try things and suggest things that back in the day when I did my surgery 20 years ago, the doctors to me were a little bit more comprehensive and advocated and followed your path of care. There is such a difference in when I went through surgery over 20 years ago and where I'm at now, and how physicians handle your care. And I think we have to be better patient advocates today than we ever had to be years ago, and that's a story for another time. But I just encourage you to advocate for yourself. Ask for a myelogram if you haven't had one. And let me mention that I had a nerve test done before, and it showed my nerves were all fine, that nothing was wrong. I know that's not true because I have no feeling. I have like numbness in these fingers. Something's causing that. Anyway, that was right after my first surgery. So advocate for those tests. But I decided I couldn't have the surgery, this was in August, until January anyway, because we had such a big travel schedule with our YouTube channel, with Destination Jackpot. So I had commitments, I had to see that through. And nothing was severe on these MRIs or myelogram that I had done. So I didn't feel like the urgency was there. Although I will say I was concerned, and I'm still concerned about further damage to my nerve or permanent damage that this could cause if I delayed a surgery. So I got the myelogram, and I put off going back to see this neurosurgeon, and kind of took matters into my own hands, talked with my nurse practitioner that I see, who has become such a dear friend of mine and such an advocate for me, and said, I think I'm going to try these conservative treatments first. First of all, I don't have insurance, so I need to get insurance. So because this is pre-existing, I couldn't get insurance. We're self-employed, so I don't have access to a group plan. That was a problem. I couldn't afford to pay for another surgery out of pocket. So I was able to get on a healthcare plan through the marketplace, and that was a saving grace for me. That was going to be start on September 1st. So I had an indemnity plan which would reimburse me for certain things, a certain amount of visits and myelograms and CTs, never the full cost, but it helped. So I put all my math together, chose the right medical plan for me, decided September 1st I'm going to start on physical therapy. 2 to 3 days a week, talked to my doctor. She made a referral for physical therapy. Started seeing a fantastic physical therapist who would really do some he did dry needling. We did a series of exercises. He gave me exercises to do at home. I went through that whole process. I'll do a separate video on all of that. And sometimes I would get a relief for a day or two, but then it wouldn't be relief. And so I did this for almost 2 months, and wasn't having any relief. At the same time, I decided to go see a new pain management doctor who was referred to me by a friend. So go to see this pain management doctor. I was in tears. I think I was in tears because I'm not sleeping. I'm in so much pain. My quality of life is greatly being affected. It's hard to ride in a car. It's hard to drive. I can fly, but I have to have all these pillows around me. I mean, it's really affecting my daily life. Working on a computer, which so many of my businesses require from me to work from a computer, it causes me like to have PTSD or something. I don't know. It's something about maybe my posture and the way I'm doing the keyboard and how I tense up when I'm doing that keyboard that causes this great amount of pain in my neck that puts me down for days. So my life is greatly being affected, and I hadn't slept in 3 days when I went and saw this doctor, and I just needed somebody. Appreciate you following along my journey. And if you know somebody that's struggling, even if it's not their neck or their back, but they're just having chronic pain issues or mental health issues, invite them to follow along and subscribe to our channel. We're going to be bringing you so many things that are going to help anybody in your everyday life restore hope, purpose, faith, and strength. So I hope if you enjoy these videos that you will choose to subscribe. Be sure to comment because it really helps keep me going, and share. That's how you can help us, help you, and help others. Until next time.